Mark and Brian, Fitness4Life, wishing everybody a Merry New Year and hope it's a good one for everybody. So,
Be safe out there on that ice.
yes. So, what we're going to talk about today, plantar fasciitis, that seems to be something we see a lot. And even when people haven't come to therapy, it seems like a lot of people you talk to will say, I've got plantar fasciitis, I've got this. And so, typical treatments for that is you go to the doctor, they say, never go barefoot again, and usually they put you in an orthotic. And that's okay. We have a little bit different approach. Okay. Not saying that that's wrong. And certainly everybody's got patient's best interest at heart. But our approach is going to be more from a functional base. The thing I have against not ever going barefoot again is we weren't born with shoes on. We're designed to go barefoot, and you should be able to do that. Okay. So let's talk a little bit about the anatomy and that plantar fasciitis, because there's a lot of misnomers out there. So this was our last patient. They donated their foot to me because they didn't make it. But this is a right foot. And if you look at this, you're going to know this is the heel. This is the heel. And you're going to see a little spur here on this heel, right here. Okay. Now, the biggest thing that people tell me is that they come in and they had an x-ray and they got heel spurs. Heel spurs are normal. It's not an issue. But the biggest thing is the heel spur doesn't cause the pain. It's the connective tissue that attaches to it that's causing the pain. So it's not your heel spur. Your heel spur doesn't mean anything as far as pain-wise. So you've got your plantar fascia goes from here all the way up to the base of all 5 toes. So it covers this underneath here. Now, what happens with that and why people typically get plantar fasciitis? When we walk and you take a step with your right foot, okay, your foot is going to collapse down, which means your arch compresses, goes towards the floor. Your heel goes out a little bit. And what that does is that loads the muscles and that makes the foot soft so it can conform to the ground. When you do that, and that happens when you take a step with your right foot, your leg turns inward a little bit, which is causing that foot to collapse a little bit. That's what it's supposed to do. Conforms to the ground, it loads the muscles. When you take a step forward, then, though, your leg is going to rotate outward a little bit, which is going to take your foot, turn the heel in a little bit, bring the arch back, and that causes stability in the foot. So now you've got a strong surface to push from. So the normal mechanics on this, you take a step. And if I put my hand on my side here, you take a step, you're going to see it rotates in a little bit. And you can even see through a shoe that collapses the arch a little bit. You conform to the ground, but as you step forward, that leg is going to rotate slightly out, and it's going to drive the foot into a stable position. That's what has to happen. Plantar fasciitis, when people take their step, they usually don't get that rotation out where their heel then causes their arch to lift and the foot becomes stable, so they've got a stable base to push off of. So they're pushing off a unstable foot, which then, because that's keeping that plantar fascia on stretch, keeps that overstretched, starts breaking down, starts getting painful. And that's typically what causes plantar fasciitis. The other misnomer with plantar fasciitis is the name itself, fasciitis, with the itis on the end means inflammation. Typically, these problems are not inflammation. The inflammatory process goes away typically in a few weeks. Then it becomes what they call an osis, so plantar fasciitis, because that means degeneration. That's why a lot of times an injection doesn't work, because there's no inflammation there anymore. It's degenerated.
Chronic, right?
Chronic. Correct. So what we want to do is show you some treatment options for how to work on this at home, hopefully prevent it or help it if you already have it.
You might have said this a little bit, but part of the plantar fascia and the way the foot works is, as you step and the heel kind of, like Mark said, kind of goes out, the forefoot kind of collapses in. That's just the normal way that we walk. So there's kind of a ringing effect almost as you walk of your foot and your forefoot and your hind foot kind of doing opposite movements to absorb the forces that happen when you walk. So my opinion about orthotics is, yeah, they're great, but sometimes they keep you in such a rigid position that you can't conform to the ground. So, as you're walking, it's good to be able to conform to the ground. And a lot of shoe wear that we wear has a bigger arch or a flatter arch or a tight toe box. So your foot can't really move the way it should. So if you can think about it, if you just were walking around like this all day, eventually your hand would start to get kind of tight and you wouldn't be able to do things because it's supposed to move and it's supposed to conform and it's supposed to adjust to the different surroundings. So that's why we like to walk barefoot a lot. So kind of promote that. Anyway, I think that's all I had to say with that.
Very good.
Woo! How are we doing? I'm sorry.
All right. Further questions, contact us at fitness4lifept.com.